Hello and welcome to the Pediatric Brain Tumor Foundation's webinar, Facing Scanxiety, Managing Fear and Uncertainty in the Pediatric Brain Tumor Journey. My name is Alex Henderson, and I'm the Bilingual Family Support Manager for the Pediatric Brain Tumor Foundation, and thank you for joining us today for this important subject. Before we get started, I have a few guidelines to review. You are muted for this webinar, and your video is disabled, but we welcome questions during and after the opening remarks. Please type your questions into the Q&A feature found at the bottom of the Zoom window. We will not get to every question, but we'll try to answer as many as possible. And we are pleased to welcome Dr. Danielle Chambers alongside PBTF Family Support Manager and Certified Child Life Specialist Jenn Kelley for today's webinar. Dr. Danielle Chambers is a hematology oncology psychologist at Nationwide Children's Hospital. She has been a part of the Nationwide Psychology team for 3 years. She specializes in helping children, young adults, and their families adjust to new diagnoses and support coping with a variety of difficult aspects of oncologic treatments. Dr. Chambers routinely provides support related to assessment and treatment of anxiety, mood, and behavior challenges that children often face throughout treatment. She's also passionate about supervision and teaching and is part of the internship supervision team at Nationwide. And when away from work, she enjoys exploring all of the family-friendly activities that Columbus has to offer with her 6-year-old son. She's honored to be presenting to this group today and is looking forward to talking with many of you further. And alongside Dr. Danielle Chambers today is Jenn Kelley. Jenn Kelley is a family support manager with the PBTF, where she's been a part of the team since December 2021. Prior to this role, she spent 12 years as a certified child life specialist in hospital settings, with nearly a decade spent supporting inpatient oncology families at a children's hospital in Wilmington, Delaware. In addition to providing psychosocial support, she ran an internship program, facilitated clinical supervision, and coordinated a bereavement committee. Outside of work, Jenn lives in a suburb outside of Philadelphia. Her years of experience working with families during both joyful and heartbreaking moments have profoundly shaped her approach to supporting families and communities in crisis. So it gives me great pleasure to introduce Dr. Danielle Chambers and Jenn Kelley.
Thank you, Alex. We are so excited and honored to be presenting with you all today. It's nice to meet everybody virtually. So we are going to be talking through a few different aspects of Scanxiety today, and I just wanted to start with a brief overview of some of the things we'll be talking about. So we're going to talk about Scanxiety. When does it happen? Why does it happen? What does it look like when it does happen? We'll then transition into talking just a little bit about what it can look like for caregivers and children, recognizing that what it can look like varies so significantly here. We can then talk a little bit about communication strategies for parents, children, healthcare teams, followed by a discussion of a few examples of coping strategies that can be used before, during, and after scans, because each of those pieces of this process can certainly be stressful. And then lastly, we'll provide just a few resources for you to leave here with today. So many of you can likely assume or know very well what Scanxiety is at this point, but just a place to start to orient us all to what we'll be talking about. Very simply put, Scanxiety is anxiety, worry, or fear related to follow-up scans. It can be related to any part of the process. Oftentimes it's thought about as worrying about upcoming scans. You can also experience it during the scan in response to worry about pieces of the scan itself. It is incredibly common, very normal within the context of treatment. Scans are stressful and hard. I want to highlight that while we will be talking about several different strategies for coping with Scanxiety, our goal is not to eliminate anxiety because unfortunately that's not typically realistic. But our goal is to find ways to optimize coping in order to decrease worries and the distress that it can accompany scans. So while anxiety or Scanxiety is incredibly common, a person's experience of Scanxiety is very unique to that individual. And there are very, very many factors that can impact coping. We've listed just a few here, but that certainly isn't an exhaustive list. So the child's age can impact coping, right? As the child gets older and starts understanding more, they may cope better. Or as they get older and understand the significance of what is happening, there could be additional challenges that arise. The type of tumor can impact coping. We expect different things from different types of tumors, and these different expectations can impact how caregivers and patients feel about scans. Previous experiences can also impact coping. This is something we'll talk about more a little bit later, but certainly if scans have historically been challenging or have yielded difficult results, this can exacerbate anxiety during future experiences. Stage of treatment can also impact coping, right? Families who've been navigating treatment longer may experience improvements in coping as they feel more confident in their coping plan. On the flip side, some families endorse worsening Scanxiety as treatment progresses, depending on things like prognosis, treatment fatigue, or previous negative experiences. Then lastly, the baseline coping can impact Scanxiety. So if you or your child is more anxious at baseline, you may be at risk for experiencing some more anxiety than other people. And again, certainly not an exhaustive list here, but just a few of the factors that can contribute to such a wide range of what we see or how we see Scanxiety present. So while one of the purposes of us coming together is for myself and Jenn to provide some information, another purpose is for us to create space for families to connect with other families who've had similar experiences and share thoughts on these experiences. So we'll be asking a few questions like this along the way. Feel more than welcome to participate and also don't feel like you have to. But if you would like, please feel free to answer this question. You can type in the chat. We'd love to hear your thoughts on symptoms that you or your child has felt because of anxiety.
We'll just wait. I'm keeping an eye on the chat. We'll give it a minute and see what others share. I'm wondering if the chat is enabled. Perhaps not.
Good call out, everybody. Sorry about that.
So we'll work on our on the back end to get that enabled. But we can keep moving, and then if we I'll let you know if I can pull in some of those responses once we have it enabled.
Sounds great. And I think on the Q&A, I saw things like anxiety, fear, worry, certainly things that can be experienced there. Moving on to, again, some of these you all so kindly and bravely called out in the Q&A, but symptoms that caregivers can experience. Again, I could have 1,500 slides on this, and I probably would not cover everyone's experience, but just wanted to call out a couple of the more common examples. First, I think the most obvious one, you may experience worry thoughts about upcoming scans. How will the scan go? How will my child cope? What will the results be? You may go into the what ifs. What if the tumor got bigger? What if my team isn't willing to offer sedation? What if my child is more fearful? You may also experience difficult memories of previous scans or about your child's treatment journey. The way our brain works is that the negative or difficult memories are much more salient. They stick out in our mind, and our brain tends to put a magnifying glass over those. And this can inaccurately skew how we assess the likelihood of something happening again, which can increase anxiety. Thoughts may be persistent, they might be difficult to control, and they could impact several different areas of your daily life. You might find yourself getting more distracted at home or school. Home or school. You might find yourself feeling irritable, anxious, sad, any number of difficult emotions. Your sleep may be disrupted. Sometimes people will say that their bodies know that they're stressed before their mind does. So as scans approach, you might just broadly start feeling off without necessarily knowing why at first. And it's possible that anxiety before scans is contributing. The timing and the severity of symptoms also varies from person to person and experience to experience. There may be some scans where you cope exceptionally well and other scans that feel more challenging, and that's very normal. The child's anxiety, symptoms of anxiety can vary just as much as caregivers' anxiety. You might notice that your child starts asking more questions about scans or recalling difficult memories about scans. They might need a bit more reassurance. Even if you've answered that question once, twice, three times, they might ask again. They may ask, can you remind me again, what is the scan going to look like? What are we going to do on the day of the scan? You may also notice some increased emotion dysregulation, which can look like temper tantrums, increased anxiety, or increased increased desire to be close to the caregiver. They could experience difficulties focusing in school or sleep difficulties. Depending on what you notice with your child as scans approach, it might be worth communicating with your child's teacher to give them a heads up about what is going on, how they can best support your child, and what they might expect to see from your child.
Thank you, Danielle. I'm going to transition us into talking a little bit about the importance of communication. We'll first talk about caregiver to healthcare team communication. It's really important as you're meeting with the team to share the observations that you are witnessing both emotionally and physically from your child. One of the things that I think can be helpful is monitoring trends that you see or themes. So maybe this time you're experiencing or you're witnessing new emotions coming from your child leading up to scans than last time. And so it's important to share those things so we can kind of keep them in mind moving forward. And right along with that is asking questions so that you can best prepare yourself and your child. We're going to get into that in a little bit more detail soon. But I think it's important to come up with those questions ahead of time that would be beneficial to know answers to, so that you can best answer them for your child if they have those questions as well. Knowing when to expect results is a big one. This is something that comes up a lot, and it varies team to team for a lot of different reasons. So it's important to have that expectation, be realistic, and know that there is no reason that other than it's not expected to get results until 24 hours later. And maybe there's no need to worry that it's taking longer and things like that. It's really helpful to be clear about your needs. Sometimes it's harder to understand what your needs might be, but when you find those nuggets of reasons that are things that are going to be helpful to you in this experience, call them out and make sure to share them with the healthcare team. Of course, being collaborative in decision-making is important along the entire journey, but certainly in this process as well. Don't forget that you are part of that team. Everyone is there on the same side. And then don't forget to discuss emotional support for you as the parent or caregiver as well. I'll get into this in a little bit, but there are options as well. You need just as much support when it comes to the emotional impact that Scanxiety can have. And so next is the communication between you as the parent or caregiver with your child. So a lot of the same concepts here, but just bringing it down to that developmentally appropriate level for what works for your child. Do they seek a lot of information? Do they want something in short snippets? Really you already know about them, what has worked in the past, and kind of continuing to reassess what's working or not working. Certainly acknowledging and validating their emotions is important, letting them know that you're a safe person they can talk to, sharing that you have some of those same emotions or that other kids have the same experiences as well, and just helping them feel heard can go a really long way. Certainly encouraging that open dialogue, really paying attention to those nonverbal cues. Does it feel like the right time to talk about this? Are they in the middle of something else and it's sort of on your checklist to talk about it because you're so worried about it, you just want to get it over with, or it's going to turn into more of a conversation and that makes you anxious as the parent. Are they sort of hearing a little bit and then they've moved on, and that's okay too. So maybe we can pick it up at another time. But just knowing it can be really fluid. It doesn't have to all happen in one setting at one time. And then I think one of the most important things is just constantly providing that reassurance that You are on their team. There is a team of people there that are for you and your family, and anyone is able to answer questions at any time. That reassurance can really go a long way. So I don't think I'd be a child life specialist without talking about the different developmental ages and how that impacts coping. And this can really be coping leading up to the scan, during the scan, post-scan, really any coping in general. So I like to see it broken down in these categories because I think it helps kind of be able to frame the conversations that you have and the interactions you have with your children during these ages. So those preschool age children, it can be really important to focus first and foremost on the comfort and that reassurance that I was just talking about. Helping build a strong foundation of a safe space, that you're the safe person. They already know that you're the safe person, but even when you're having these difficult conversations around something that might be uncomfortable for them, it's always important to use simple, clear language. I tell parents frequently, come up with a couple lines that you're comfortable with and you've thought through that you can repeat over and over again, because a lot of times it can be really difficult to have that information sink in for the younger kids. So the more they hear the same thing over and over again, they begin to trust it more. And then certainly using play to prepare them or to work through the coping that they're navigating. And so medical play is an incredible way to do that, but it doesn't have to be medical play per se. It doesn't have to be led by anybody other than the child. Sometimes it's great to just set up the environment so that they'll casually engage in some of the conversation around coping with a scan while they're playing. And so maybe just sprinkling in some gentle medical supplies into their the dolls that they're playing with, or action figures, and taking those small opportunities to maybe ask some questions or play alongside them, or at the very least, just being aware of the conversations they might be having through their toys that can kind of lead to you to have an insight into what they're thinking about, what maybe they're more worried about or more focused on, or really sometimes I think this is a great time that they can highlight some misconceptions that you're able to kind of swoop in and reframe a little bit for them. Moving into the school age child, you're going to hear us talk about distraction a lot through this presentation, but distraction really is so important. It's, there's a balance needed, because we don't want to distract away from things so much that the child isn't able to still process through or talk through what it is they're worried about. But it can be really helpful as well to have some of those moments to distract from the immediate worry that they're feeling, or really able to just engage, kind of reset a little bit. And so it can be really helpful, certainly in the before the procedure piece. And when we're talking about language to use, the process still needs to be explained simply, but steps can be shared. This sort of age range is great for really liking rules and a clear process. So as much as you can kind of simplify what to expect, I think that goes a really long way. And then questions are huge in this age range. So really allowing the time and space for any and all questions, but also keeping in mind you don't have to have the answer or the right answer all the time, as long as you're sort of just sharing that, you know what, I don't have that answer, but that's a great thing that we can look up together, or I'm going to write it down so we can ask the team next time we see them, things like that. And then for adolescents, certainly getting into more detailed information, although it's important to start to understand where your adolescent is in terms of their coping. Some it's they're information seekers, and that feels really good to them to get more details, and others are a little bit more avoidant and would prefer basic information. So give them that choice, ask them, or take lots of pauses when you're sharing a lot of information to say, like, this, I'm sharing a lot with you. Would you like me to keep going, or should we talk about it at another time? And just pace yourself and feel it out as you go along. The next one is huge for our adolescents, is respecting their need for control. Again, making them part of the decision-making process can be really helpful, even if it's small things, about what's going to happen after the scan. Are you going to go out to lunch? Because that's a nice thing to look forward to. Do they get to have, some other fun activities to look forward to? But even to the bigger things, talking about when we're transitioning out of needing sedation, sometimes if that's a possibility, include them in that conversation, again, at a pace that feels comfortable and right for you. And then certainly encouraging that open conversation, but being an active listener. So really giving them the space to talk and share their feelings as much as you want to share the information that you might have as well. So the next part that I'm going to go into is coping strategies leading up to the scan. And so for some people, this leading up period can happen months before, where how did we get here so quickly? There are only 2 more months until our next scan. For others, it doesn't start to kind of creep in until the week of. It could be up until the moment the appointment happens, really any of that time. If you're feeling some of those symptoms that Dr. Chambers was talking about earlier, that's what I'm talking about here, is how do we cope in those that time period leading up. So I think it's most important, as I already shared, really to understand what the day will look like. Do you have multiple other appointments that you're squeezing in? What is the sedation plan going to look like? Trying to get as much of a clear picture of what to expect, knowing that there are inevitably things that come up and are going to happen, and so needing to remain flexible. But the more that you can have a clear understanding of what to expect, the better that you can prepare your child. So another thing in that preparation piece that I like to call out is that just because your child might be way more familiar with medical procedures than other children their age, especially if they've had their diagnosis for quite a while, it doesn't necessarily mean that they don't need any of this preparation that you did in the beginning, or that someone else might do if it was their child's first scan. I think it's always important to kind of check back in with your child and go through this every time of asking questions and making sure that you're setting that strong foundation for as effective coping as possible for your family. Certainly acknowledging and normalizing the feelings leading up. This goes for parents and children as well. It's very valid that we're starting to feel and notice some differences, and we can start to feel our anxiety creeping up a little bit, and maybe acknowledging what's happening for you as the parent as well. Again, just helping them feel like it's okay to have those feelings. There's nothing wrong with it, and that it's important to just call it out. And then creating a plan for the days leading up can be tremendously beneficial. So I think having a routine is important always when it comes to coping. So, making sure that if your child is going to school, typically, that they still are going to school right up until, the day of their scan, making sure that as much can be in place that is normally there or typically there as possible. I think that really helps our brains feel safe. And then certainly coming up with the routine of what that day is going to look like based on the information that was shared from your team. Again, is your appointment early in the morning and then you get to go home afterwards? Do you have a lot of appointments? So how can we set up the day? How can we look forward to something that maybe we can use as that distraction to look forward to? And speaking of distraction, I think it's really helpful to have some go-to activities. I always tell parents kind of come up with a menu, whether it's in your mind or why not write it down and make it a little bit fun, of things that are helpful. When you're in that flight or fight mode, you don't have to, it's not one more task to try and think of what helps me. Is it drawing? Is it reading a book? But you already know, oh yeah, okay, this is my go-to thing, that when I need to kind of refocus a little bit, this is what I can do. So coming up with a list of something like that together can be really a great way to work as a team. talk with your safe people, whether it's you as the parent talking to other parents that you've included in your circle who understand what you're going through. Maybe for your child, it's talking with, just their friends that they're able to share how they're feeling. Certainly if they're an adolescent, finding those people that are kind of your go-to people you already know, you have established a good relationship with, and they're not going to be meeting you with any judgment. And then telling them too, I think it's important to say, I'm not looking for advice right now. I just need to talk a little bit about the fact that I'm really anxious that scans are coming up. And that can be really powerful as well to set sort of that boundary ahead of time. And then staying as present as possible. Certainly easier said than done, but I think something that we recommend that you're working towards as much as possible. In these next slides, I'm going to talk a little bit about ways to do that. Certainly mindfulness can help with that, and it's a practice skill that is sort of always needing a little bit of practice to stay, to have it remain and feel like a muscle that you're flexing. So even for those really young kids, there's great ways to do it. I think books can be tremendously helpful when it comes to a lot of different things, normalizing lots of big concepts, but even in mindfulness, bringing in some of that imaginative play. So these are just sitting still like a frog and breathe like a bear, two really good examples of that. And then excuse me, I think something else that's a great resource is called Imagination Press. It's through the American Psychological Association. It's a great list of vetted books by topic. So if you want to search about topics such as anxiety, you can go on. And it's a great starting list to find some things that might be really helpful for your child. And then as we move into the adolescents and adults, certainly apps can be tremendously helpful. These are three that we're calling out just because they're great ones that have been around for a while. They're either completely free or have free versions of them. So it's worth trying out and seeing if it's something that might help you in those really high stress moments when you're trying to refocus a little bit and stay present to give a try. And then I think the last thing that I'll say for my part right now is that it's important to know what resources are available at your hospital. So every site is a little bit different. Resources are a little bit different. Sometimes things change. So it's really important to ask the team some questions about these resources. The first one, certainly seeking out psychological support. A lot of families will ask if there's someone that we can recommend, a psychologist or a provider that has experience working with children who have been hospitalized. And the best place to do that is to find them within your own hospital. Sometimes there's neuro-oncology specific psychologists, oncology specific psychologists, and at the very least, someone who works in a hospital and is always working with children who are hospitalized is such an incredible resource. And we certainly recommend looking into that if it's available at your hospital. Certainly, when you're noticing that things are getting a little bit beyond what's helping, what's worked in the past is no longer working, and you've tried a few different things, this is an incredible path to go down. Child life specialists able to prepare your child and help them during the procedure, provide distraction, that medical play, just lots of really good tips and tricks up their sleeves to be able to support families during this situation. I think it can be helpful to understand, build that relationship prior to the stress point moment. So building that relationship ahead of time can be really helpful. Therapy animals are a great source of comfort and distraction. Certainly something that can be used as you're waiting for scans to start, as you're coming out of sedation, or even after appointments. Same with art and music therapy, great sources of processing through the experience, as well as distraction. Practice scanners are really a great way for the actual experience to be tested out and gain comfort. A lot of facilities will have scanners that are used just for the purpose of learning what the experience is going to be like. I think this is important too if a child is If you're trying to test out no longer using sedation to see if that's an option, just getting really comfortable with the scan experience. If possible, sometimes during scans, if a child is awake, music and video can be used as a distraction. And then knowing the types of medication available. So there's a wide range of sedation medication, and not all types are appropriate for all children. There's lots of variables that go into it, but certainly worth talking to your team, especially, as in that collaborative conversation to decide what might look the best for your child, and obviously to make sure that the scan is able to get done as effectively as possible.
Thanks, Jen. Just as Jen provided a list of resources and options that are really helpful for preparing children for scan days, having a coping plan for your kids. Also important for parents to have their coping plan. And just as every person's experience of anxiety is unique, so too is everyone's preferred coping strategies. So nice to have a few different options. Parents having a good coping plan is certainly important for themselves as the caregiver, but it's also important because caregivers' anxiety can certainly impact children. And oftentimes when people hear that statement, they assume it's negative. But if I'm anxious, I'm going to make my child anxious, and that's a bad thing for my emotions to influence my child. But if navigated appropriately, it can really be a really great thing, a good, strong source of support. You can take opportunities to model expressing your emotions to your child, as Jen was saying, to normalize the expression of those emotions. You can also model engagement in coping strategies, right? I'm feeling really anxious right now. I can tell I'm anxious because my stomach hurts a little bit. I think I'm going to take a few deep breaths, and model that and vocalize that for your child and for yourself. The second point here, navigating what you all do with your children on a day-to-day basis is not something that any parent should have to do, period, but especially not something that any caregiver should have to do alone. And so, as Jen said, finding your people who you know have your back, and they get your experience to an extent that anyone can without actually being in the situation. And who are there to process with you. I love Jen's point on telling your support person what you need right now. Do you need space to process? Do you need feedback? Do you need to talk about anything but scans? And letting that person know how they can be most helpful to you. I am going to jump on Jen's bandwagon of being really pro distraction to a certain extent. It sometimes gets a bad rep, and can be misinterpreted as avoidance, but if it's used in the right way, it can really be helpful for giving your brain a break. Worries about scans and about treatment and about disease, those are really big worries. And if you never give your brain a break from those, that's exhausting. So certainly used appropriately, distraction is a great go-to for caregivers as well as kids. And then lastly, there are relaxation strategies that can be used, and I'm going to just talk about a couple more here next. And this is one of those other days. I feel like two of our themes are, one, distraction is amazing, and two, everyone's experience is unique. And so this is another one of those where relaxation looks different for everybody. When we are anxious, we focus on a lot of different things: the past, the future, the what ifs. Mindfulness is a strategy that simply gets our brain to focus on the present moment. So not worrying about the past, not worrying about the future, just thinking about what's happening right now. And the most powerful way we can do that is to get some of our senses involved. So one of my favorites is the 5-4-3-2-1 mindfulness strategy, which incorporates all of your senses. So an example of this might be, name 5 things you can see. And I would say a book, a table, a window, a car. It lists 5 things. 4 things you can feel. So I feel my cold hands, the hard table, the soft chair. 3 things you can hear, 2 things you can smell, and 1 thing you can taste. The senses don't have to be in that order, just as an example. But the more senses you can incorporate, the more effective it will be. And certainly starting a strategy like that with finding a quiet, calm place, taking a few deep breaths to center yourself, and then go into involving your senses one by one. Again, like Jen mentioned, you can also use any number of relaxation apps, or just take a minute to do some deep, controlled breathing. Mindfulness can be a time that you set aside each day. It can also be something that you work into daily activities. So as long as you are focused on what you are doing in that moment, you are focusing on sensations you are experiencing, it can be effective. So for example, as you wash your hands, do so gradually. Focus on the soap as it gradually spreads from the tips of your fingers to your wrist. Focus on the water as it drips between your fingers. As you eat a bowl of ice cream, put one bite in your mouth, close your eyes, and focus on the sensation of it melting. So a number of different things that you can do, if just to remember that the goals are to slow down and to be fully present and aware of what is happening in that moment. And I also wanted to call out that relaxation, mindfulness in its more traditional sense is not for everybody, and that's totally okay. The goal of relaxation is to simply help you feel more comfortable and more relaxed. And there is an endless number of ways you can do that, which is individual to each person. So just reflect on those activities that make you feel happier and make you feel calmer. This can be playing video games, journaling, doing a puzzle, going out with friends. If it is generally healthy, meaning it doesn't cause harm, is my definition of healthy in that moment. As long as it doesn't cause harm and it helps you feel better, it's likely a good coping strategy. And of course, it's important to pay attention to the dose of that coping strategy. How long are you engaging it? Your teen may be super happy to play video games for an entire day, but if it keeps them from going to school or sleeping, that might not be the best strategy in that dose. So balance is also key, and trying a few different things to figure out what works for you. Now, sometimes when people have anxiety, it escalates to the point of panic. And there are definitely strategies for addressing panic when it occurs, but the most effective approach is to decrease the risk of panic symptoms in the first place. And so the best way to do that is to routinely engage in these relaxation or coping strategies, regardless of the level of anxiety. So if you can kind of envision a cup that's gradually filling with water, the water represents the stressors and the cup represents your capacity to cope with those stressors. So as you encounter stressors throughout the day, throughout the week, throughout the year, your cup is gradually filling with water, or sometimes less gradually, making it more difficult for you to kind of move throughout your day without spilling the water, so to speak. And every time you engage in a coping strategy or relaxation exercise, you're poking a hole in the bottom of that cup and draining some of that water out. You may only have time to do a quick 30-second breathing exercise, and that might equate to a small poke in the cup that drains some of that water. Or maybe you have time to do a more in-depth coping or relaxation exercise. Regardless, anything helps. If you can poke holes in that cup throughout the day and drain some of that water, your cup is less likely to overflow. So in other words, if you engage in those coping strategies throughout the day, you'll be less likely to become overwhelmed by the stress. It can also be helpful to identify triggers or stimuli that are associated with panic attacks. So for example, does anxiety tend to increase in response to certain smells or sights? Are you more susceptible to siblings fighting or stressors at work? Knowing your triggers can help give some insights into scenarios where you should really focus on increasing use of coping strategies. So if you know that siblings fighting is a particular trigger for you, maybe you take a couple of minutes before you come inside and take a couple of deep breaths to prepare for that. Maybe there are certain triggers that are so significant, and when you are at a point where you feel you are taxed to the max, maybe those things are things that you can avoid altogether temporarily. And maybe they're not, and they're things you just have to navigate as best you can. So unfortunately, even with some of the best laid coping plans, panic happens. Sometimes the stressors are just too big and a person's coping capacity is just too taxed. There is not one of us in this room who does not have a limit, and our limit looks different from day to day. So what do we do if a panic attack does occur for ourselves or for our children? I think first you can consider decreasing sensory input. So if possible, find a quiet place to sit with dim lights. For your child, I would recommend only one person speak to them at a time. So I think understandably when a child is panicked, people rush to them and they try to help them, and maybe 4 people are trying to help them at once. And that can feel overwhelming. So if possible, just one person speaking at a time. Panic is contagious. So if we do have, you are likely to feel at least increased anxiety if your child is panicking. And that is normal and something that you can be super mindful of to try to, in that moment, avoid expressing that anxiety. And you can do that by lowering your tone of voice, your rate of speech, the number of words you are speaking, and the volume of your voice. You can use simple repetitive instructions or supportive statements like mommy is here, grandma's here, daddy is here, you are safe, things like that. I would recommend proceeding with caution when encouraging breathing initially. When people panic, that can be a very uncomfortable sensation in their chest, and drawing attention to breathing at first can actually increase anxiety because it increases awareness of that painful sensation that they have in their chest. Also, probably if you are in a place where you're panicking, you've tried the deep breathing and that hasn't quite worked for you. And so it can increase distress and or frustration when people encourage you to take deep breaths right away. Now, once the panic decreases a little bit, you can start giving directions on how you want your child to breathe. For example, if they're okay with touch, you can say, breathe in as my hand goes up your arm and breathe out as my hand goes down your arm. Or breathe in for 4 and out for 4, guiding them with counting. So we are only tasking them with breathing. We are not also tasking them with figuring out the rate of their breathing. We are doing that for them. When a person is in a state of panic, they enter into survival mode. Their capacity for engaging in higher level complex thinking is significantly impacted. Oftentimes when I work with kids, teens, parents who have panic attacks, they understandably are like, this is a really big problem. It's a very uncomfortable, very scary experience. And they assume that the size of the intervention needs to match the size of the problem. But because when you're panicking, your brain does not have full capacity to engage in these complex solutions or complex thinking like it does at baseline, we actually want to make the interventions really simplistic. So again, when you are panicking, your mind tends to go in many, many, many different directions, and we want to get our minds to focus on one thing, back to mindfulness. Guided breathing, once we have taken our panic level down a notch, is one way to do that. But other ways are things like holding ice, putting a cold cloth on your neck, smelling a strong scent. The reason these strategies are effective is because it really does not take a lot of brain power to focus on these sensations, right? So regardless of how much you are panicking, you are going to feel an ice cube in your hand, at least to a certain extent. Once you can get yourself or your child to feel that ice cube, for example, you can start asking them questions about that ice. Right? What does the ice remind you of? Do you feel the cold spreading? I will often ask kids, like, what temperature do you think the ice is? I don't actually care if they tell me it's 2 degrees or 20 degrees or 200 degrees, but the point is to get them to think about the sensation that they are feeling. Other strategies you can try is a color naming strategy. So name the colors that you are seeing, starting with very broad colors, right? I see black, white, blue, because that's the capacity I have for color naming at first. And then as you start to take it down a notch, you can say the cabinet is black with gray outline. The chair is blue with looks like crumbs from somebody's lunch. So just to get things more specific, get your brain more involved and more focused on the present moment. There is no way to get somebody to snap out of a panic attack. The idea is to ride the wave while gently guiding to a place of calm. So then after the panic attack has passed, consider debriefing about the cause of the panic attack and what was helpful. Again, you are not going to be able to engage in complex conversations with your child in that moment. And I hope I'm not going too out of order here, Jen, but I did see a question pop up on anxiety versus panic symptoms. And I think it's a fantastic question. And I should have thought to include symptoms of panic in a slide about panic. But panic differs from anxiety because it typically feels very, very difficult to control. I think that's the biggest. That's probably the biggest symptom of it. They might feel physical symptoms like heart palpitations. They might have difficulty breathing. They might get sweaty palms. And so really panic does exist on the spectrum of anxiety, but it's at the really far end. And I think that inability to control the symptoms is the key symptom that distinguishes it from anxiety.
Perfect. Thank you. I'm gonna now talk a little bit about the coping strategies during the actual scan. We're not gonna spend a ton of time on this because I recognize that many times there is some level of sedation provided to um, patients who are getting scans for their brain tumor diagnosis. But I do want to touch on it because certainly there are some things to do. First and foremost is that distraction again, really things based on age and developmental level. Certainly trying to engage them when possible with someone else in the room, whether that is a parent, if possible, to be there, or one of the staff members. Really just trying to tap into what has worked for them in the past when it comes to distraction during medical procedures. Reinforcement can be really beneficial when being given by either the parent if they're in the room, or those staff members. Usually there's incredible staff in the room that are able to provide that reinforcement of that's really concrete and immediate. Thank you for staying so still. You're doing a really good job. Asking when you need a break or you have a question. That reinforcement can go a really long way. And then again, giving choices if a parent is allowed in the room. Who do they want in the room with them? What do they want to bring into the room with them? Just all of the nuggets that you've learned along the way during other types of procedures that they're awake for, kind of bringing that into the scenario as well. And then in terms of sedation, I think another point that's important to bring up is really understanding the impact and what side effects there might be. So there's the medical piece, certainly, but the emotional impact as well of what to expect. Is it that they're going to be a little bit more emotional coming out because of some of that medication? Is their belly going to feel really uncomfortable because of that? Because you know that that's what's happened in the past. Again, it always goes back to trying to understand what might happen to be able to keep that in the back of your mind, to be able to kind of pivot as those things happen in real time to support the child during that. You'll see too, we talked in another slide about being able to listen to headphones or something during the scan that can really be helpful in keeping that distraction going when they are just getting ready even for the scan. Some of these scans are just really long and that can be challenging. But being able to know and understand what to possibly expect can be really helpful. So some of the things that I'd like to focus on this part more, because as the parent or caregiver, if you are in that waiting room while your child's in the scan, that's a really high point of anxiety for a lot of parents. It's that waiting. It's just the perfect scenario for your mind to start to spiral if we don't try and pull it back a little bit. So it's pulling in a lot of the things we've already talked about, that deep breathing, mindfulness, meditation, any of those things are great to try while in that waiting room. And I love that Dr. Chambers mentioned how you can incorporate that into the little things you're doing. Even if it's simply while you're sitting in the waiting room, trying to notice and pay attention to the things around you. Even if you've been in that room 100 times before and you know there's a fish tank in the corner, and you know that there's a really nice lady who sits at the desk, find the things that you can notice and pay attention to and count. All of those things are the little tricks that you can use to kind of pull yourself out of that spiral. It goes hand in hand with trying to stay present. It can be really difficult. Give yourself that grace that it's not going to come easy to you in that moment if your anxiety is already so heightened. So don't go in expecting that you are going to be able to be present the entire time and nothing is going to bother you because you have your bag of tools that you're prepared to use. So give yourself some grace. You're going to do your best and certainly leave room for whatever to happen will happen. Distracting yourself, just like your child, is huge. So bring things with you. Maybe you're reading through a book. For some people, that's just too hard to focus. And they know that even though I love reading books, and that is normally a helpful thing, I know when I'm at that moment of high anxiety, I'm not going to be able to read a book. So what are some other things that you can do to distract yourself? So think it through a little bit, try out different things. Certainly lean on support. Maybe it means bringing another support person with you. Maybe that means calling somebody else or texting back and forth with someone, but really lean into those people that are your safe people that you know you can go to in moments like this. Keeping a positive focus, again, can be really easier said than done, but I think one of the easier ways to start to implement this a little bit is to have sort of a mantra that you can go to and tell yourself that you there is nothing to control in this moment. The results are going to be what they are. And no matter what those results are, it's going to guide, it's information that you're going to get that are going to allow you to move forward in what treatment looks like. And so while we don't know what path it's going to be, we know it's going to provide insight and guidance to be able to move forward. Reframing those negative thoughts can be really helpful once you can take a second, notice the negative thought, and try and do a brain game a little bit with yourself of thinking, okay, I just had this terrible thought that the results are going to be absolutely awful. How can I reframe that? If that's what my child was saying, how would I help them reframe it? And sometimes that can really simplify it, break it down enough for you to kind of push through those negative thoughts to be able to see the opposite of that. As I said, giving yourself grace and that compassion. Don't be too hard on yourself in terms of judging, "Oh, why do I always have these feelings every single time?" Just really trying to change that thought process. And again, I think similar to something like mindfulness, it is a skill. The more that you can practice that, the more truth that it holds for you, and the easier it will continue to come time after time. And I think trusting in the medical team is something that we think about at certain times, not necessarily in moments of high anxiety, where because you have to, I think, bring yourself to a place of you have to be present, and it's sort of part of the reframing process. But again, going back to that mantra piece of saying, okay, we've done this before with this team. My child is in really good hands, whether that is with, some of the physicians that may or may not be present for the exam, or it's simply the staff that are right there in the moment with your child, helping them through the scan. But that trust and knowing that you're not in control, but the people who are in control are doing everything they can to make sure that your child is comfortable and that they're getting information that's going to help guide the next steps can also be really beneficial. So moving into some of the strategies after the scan. So once the scan is behind you, this could be minutes after the scan, all the way up until that next appointment, whether that's the same day or in subsequent days. Distraction, again, going back to some of those things that were helpful leading up to the scan. That reassurance and communication can be instrumental, certainly. And I think this piece is really more for what you're providing to your child, communicating with them about the scan is over. Now the doctors are going to read the information and come up with the information they're going to share with us, reassuring them that that part is behind them, things like that. This is also where information overload can really happen. And I think sometimes that's just people's coping mechanism is to share all that information, whether it's you on the phone with a spouse or a family member sharing what happened or didn't happen, and paying attention, because if that's happening in front of your child, that might be a lot for your child to hear and try and interpret, especially as they're into that adolescent age range. I mean, really, all kids are listening more than we ever think they are, but they might be trying to understand and make sense, put that puzzle together. And again, we want to try and keep it as sort of calm as possible during this time. The other thing I think that can be really helpful, just as I talked about prior to a scan, is understanding what that knowledge, the impact can have on you or the child. So this is what we hear all the time of, this dilemma of getting information in your electronic medical record before having a conversation with the doctor. Is that something that you feel like gives you a sense of control? And the second that hits in your app, you want to go and research it and ask people that have also been in the space, try to understand and decipher what all of it means. Or are you someone that finds yourself doing that, knowing that every time that happens, it gives you a little bit more anxiety because really you can't quite make full sense of it, or it still doesn't fill in all of the gaps that are going to be there in terms of what does this mean, and where are we going to go from here? And I think that there's just it's a struggle for people because you want that information as quickly as possible, and the waiting and the not knowing can be difficult. But find a little bit of a balance of what works for you and prepare. It doesn't mean it has to go that way, but if you say, okay, I think this time, I'm going to read over the information, keep an eye out for anything that's glaringly obvious that I would understand, and otherwise, I'm going to just set it down, let it go, because I know that in the morning we have our appointment with our team and they're going to be able to go over it. For some people, it's needing to not even look because it causes so much anxiety, and that loss of control for the hours in between until the appointment. So really trying to decide for you personally what makes the most sense. And for what makes sense for you might look different than your spouse. And that's okay. But if you can at least explore that and start to acknowledge, or just even talk about that, I think it's a huge step in the direction of gaining control over the situation where you can.
Thank you, Jenn. One topic we wanted to talk on just a little bit is claustrophobia. I think this is something that is particularly challenging for patients with brain tumors because when you go into the scan, their head is completely in, and sometimes challenging to see outside of the scanner. But there are a few different strategies that patients have found helpful. So like Jenn had mentioned, practicing ahead of time. Hospital may have a simulation option that would be really helpful. If not, you can practice at home and mimic the experience as much as possible. Potentially sounds kind of silly, but getting a large box open on both sides and having your child lay in there while you as the parent walk them through verbally what that experience may be like while they are practicing those coping strategies that Jenn had talked about that are in line with their coping plan. Claustrophobia, just like any type of worry or anxiety, the best way to decrease it, really one of the only ways to decrease it over time is exposure and building in those successful experiences. And so practice can help expose and can help give kids a kind of an avenue and a way to practice those coping strategies. I know Jenn mentioned too, alternative sensory input can be really helpful, distraction like music or movies. And we keep bringing up distraction. The reason it is so helpful is our brains can only focus on so many things at one time. And so if we make our brain divide its attention between the fear of kind of being quote unquote like stuck in the scanner and a movie, we have less worry capacity for the scanner, even if it's just a little bit less. Feeling alone or feeling isolated can also increase claustrophobia. So figuring out if a parent can be present, and if not, or even if parents are present, talking to the technician to see if they can communicate regularly with your child throughout the scans so that they feel less alone and they have more updates as to the progress that they're making with their scans. And lastly, if you feel like anxiety is to a point where medication would be helpful, absolutely worth asking questions to the medical team to see what sedation options are available. And so as we've mentioned a few times, the goal is to reduce, but not necessarily eliminate anxiety. And because a certain level of anxiety will almost certainly exist, it can be hard to know whether the coping plan is working. And so just a few signs that might indicate that you haven't struck the best balance yet, and that's okay. processing, it's kind of, like I said on here, I just trial and error. No people cope identically. So figuring out what works for you can be a bit of a process, and it can also change over time. So processing emotions is not easy. It's not uncommon to experience a flooding of emotions if you are somebody who has historically coped almost exclusively via distraction or avoidance, and you are in the earlier stages of learning how to process emotions. As you get more practice at processing emotions, it can feel like you're making things worse temporarily, because that is an uncomfortable experience. But if you are someone who has now had more practice processing emotions and you're processing for an extended period of time and you feel like you are getting stuck without any improvements and it's starting to feel more like kind of ruminating and less like processing, you're getting just too fixated, it might be helpful to take a break from that and go to distraction. If you are someone who feels like you're doing fine for a while and then all of a sudden you feel like you have big emotions out of nowhere, it might be worth reflecting on whether you are approaching emotions or difficult emotions regularly versus waiting for them to kind of sneak up on you and overwhelm you. And if that is happening, finding ways to process emotions more regularly could be helpful. Again, wanted to note that your coping strategies may change over time, and that is totally normal. What worked for you during one scan might not work during the next scan. What that also means, though, is if you try something that doesn't work super well, feel free to give it another shot because it could work at some point in the future. In terms of figuring out if you need additional support, so therapy and/or consulting with a doctor about medication options are helpful for so many people. Even those people who have the best laid coping plans and find that they might benefit from additional support. It is out there for many, and it can also be sometimes difficult to find. So your team can likely help you link with that. And while anyone is certainly welcome to seek therapy support, there may be a few signs that I wanted to highlight that may indicate that it could be particularly helpful. So the first, kind of paying attention to your level of functioning. If you feel like your functioning is notably disrupted more than a couple of days or maybe a week prior to scans, you may benefit from space to process. So for example, if your child's anxiety has gotten to a place where like the week or two prior to scans, they don't separate in order to go to school. They have severe separation anxiety. That could indicate that support might be helpful. If you feel like you don't sleep for the week prior to scans, some additional support might be helpful. If you or your child are having trauma symptoms like nightmares, flashbacks, panic symptoms, seeking support could be helpful. Therapy can be a space to process. They can also be a structured place to solve clearly identified problems or a combination of both. So if you feel like you might benefit, it could be worth a shot. So coping after difficult experiences, when hard experiences happen, they are memorable. We are so much more likely to remember the one time that something went poorly over the 20 times that it went smoothly. And this can inflate our estimate of how likely we think that something is going to go, how likely it is that something may go poorly again. You can engage in a discussion with your child and with your team to identify the problem and to problem solve around that. And doing so is helpful for a couple of reasons. One, to hopefully decrease the likelihood of it happening again. But two, if you and your child are able to say, I know this experience did not go well this other time, but we have made X, Y, and Z changes, that can help convince your mind and your child's mind that it could go better in the future. And then we don't want to minimize the experience, but we want to hold space for highlighting successful experiences as well. Like Jenn was saying too, it is ideal to remain in the present moment rather than thinking about the what ifs. And also, sometimes what ifs are inevitable. Our brains just go there, even when we try really, really hard to stop it. So if your brain is going to the what ifs, at least make your brain broaden to all of the potential what if, or more of the potential what if options, not just the negative ones.
I wanted to spend a quick minute. I know we have some healthcare staff that are watching and talking about how you can help the families that you serve when they are navigating Scanxiety. So I think first and foremost is being able to acknowledge that this is a very real experience for most, if not all families, at least at some point, to be able to really normalize that this is something they're going to be experiencing and talking through what amount is reasonable to expect and what feels like it might be too much and it's time to include others into the process. Just setting the stage for talking about it at the right moment. So being able to not say on the fly, like, oh, your scan's coming up. Don't just let me know if you're worried about it. Don't worry about it. You've done it 10 times before. Those are not helpful things. Taking a break at the end of the conversation saying, I know you have scans coming up next time we see you. How are you feeling about that? How's your child feeling about that? How has it gone in the past? Just being able to level set with the family as best as possible. Encouraging that family involvement. Sometimes it's difficult for families to know when to step in and when to assert themselves into the conversation or the decision making. So invite that, encourage that. Saying, I've been thinking that your daughter has been doing relatively well these last few scans. Do you think that it might be time to start talking about not needing as much sedation the next time we have them? Or, it seems like it's been getting a little bit harder. Let's talk about some of the ways that other families have found helpful. Provide information and those resources that not only are available for the child, but let them know that there's resources for parents as well. If it's not something that's necessarily within your repertoire to recommend, refer them to someone on the team who is, whether it's a psychologist or a social worker or child life specialist. But I think just even talking about this and bringing up the conversation really validates and helps support the family feel like, okay, this is something real that, is being talked about and is brought up, because I think that there are a lot of families who feel like this topic, while it feels incredibly real to them, sometimes it can feel maybe a little bit less real because it's not talked about as often. Certainly in the medical setting, I think it's talked a lot about amongst families, certainly. But if you can kind of represent that, yeah, I'm asking about this, that must mean that other people are experiencing it. It can feel really validating to hear that and to start the conversation. Again, it might not be something that's fixed or relieved in the moment, if ever, but can be the building blocks to working towards more effective coping. And I know we're getting close to time, so I wanted to kind of bring everything together. Just remind you of the few takeaways that we really want to make sure stand out from this presentation. So we've heard these things throughout, but really what works now might not work later, and that's okay. Stay flexible and know that there are always different things to try. A lot of it is that trial and error, and that's okay. There isn't a perfect strategy that's going to work for everyone across the board. If there was, I think this wouldn't be the topic that is so important that it truly is. Create that plan as best you can, but just allow for flexibility. And it really, truly does take a team. You, your child, your other family members, your support system, the healthcare team, everyone's working together towards the best impact that they can have on this really stressful situation. I know our chat is enabled now, so I would love, as we transition into questions, just to hear from any of you if you're interested or okay with sharing something that you took away from this that you might try implementing the next time that you have scans, whether it's something for you or for your child. I am going to stop sharing and transition us as you guys pop in the chat there to the questions and answers. I first want to thank everyone who sent in questions ahead of time. We had some really, really good questions and comments, and hopefully we tried to incorporate a lot of the responses into our presentation, but we're happy to take more questions. There's a couple that we got during the presentation here. We won't be able to get to all the questions though, so if you still have a question, you can always email us. At the end, we'll pop up our contact information so you can reach out. but I'm going to jump in and get started. One of the questions, Dr. Chambers, that we got was, how does Scanxiety look different for brain tumor patients than it does for the general pediatric oncology population, if at all?
Mhm. Yeah, I think going back to that claustrophobia piece, it can feel different just because head is in the scanner, which can feel different than leg in a scanner. I think also too, it can differ a lot by prognosis. Families have different expectations for what they're expecting for the scan results, which can certainly impact coping before the scans. I think it's just as much individual differences between children with brain tumors as it is a difference between brain tumors versus other types of tumors, if that makes sense.
Yeah. I think just the frequency too is something that I was thinking about. Sometimes I think they're just, given the nature of the diagnosis, there's just a lot of scans that are happening. And sometimes the waiting for, depending on the type of tumor, for it's sometimes an if versus a when. There's going to be difficult information that's revealed. And so that can be really challenging as you're holding your breath a little bit for that. And so those are some of the things that I think about when there's a little bit of a difference. Um, Another great question that came in is there a list of questions that would be good to talk about in advance with the medical team when it comes to Scanxiety? I'm wondering if you have any initial thoughts on that.
I really like the question of what sedation options are available. I think just good to know up front, especially if your child is newer to the medical setting, you don't necessarily know how they might respond to these things. So I think that for one. Two, I'm always curious about what options are available to support coping. Is child life available? Numbing cream, therapy animals, psychology, who is available, what are the list of coping strategies we need. I think Jenn, you mentioned this too. It's better to have a list of potential supports and then not need them, as opposed to not know what your resources are and then need resources.
Yeah, absolutely. I agree with you. It's trying to set, to get as much information as you can about what to expect and what the process is like in that hospital, in that situation. And I go back to a lot asking, what has worked for other families? What have other families asked about this, and seeing what the response is from the team, because I think that can give a lot of indication as to what resources are available and just how comfortable the team is in having these conversations.
Absolutely.
Another question that I saw come in was, there's so many emotions that are involved, and there's also a lot of guilt in general on this journey that parents feel. How can we best address guilt around knowing that anticipation of, okay, scans are coming up, I know emotions are gonna get really heightened in the next week or two. How can we address the guilt factor?
Mm. In terms of guilt related to how our behavior may change, or
Yeah, and knowing that it's going to change because it's a difficult
yeah.
time, and it's happens once a year or every few months.
Yeah. You made a point earlier, Jenn, that I think you said, how would you respond if your child asked that question, or how would you respond if your child had that fear? I think similarly, how would you respond if another parent shared this guilt with you, or another person shared that guilt with you? Having grace for what you are going through too. I think that when you all are so many appointments, so many scans, it potentially becomes a very, very large part of your life, and many of you adjust so well, I'm sure. And you can kind of stop giving yourselves credit for the hard, very abnormal things that you have been faced with doing. And the range of emotional responses to that is so broad. I think too, you can vocalize it. It is okay to say, I am feeling more irritable today because of X, Y, and Z. You don't have to suppress it. You don't have to ignore it or pretend like it's not there, but giving it a name. And you can apologize for the impact that may have on people, but I would encourage you not to get stuck in the apology phase as well.
Thank you so much, Dr. Chambers. I'm gonna just put up our contact information, but I'm gonna I want to thank you so much for your experience and your expertise in sharing today. But I also really want to thank you, our attendees, for oops. Sorry, let me just get the right slide up here. I want to thank you for coming today with having your questions and really being present, asking your questions throughout, engaging with us. And we hope this was helpful for you. As soon as we wrap up, this recording will be emailed to you as well as the slides. And again, if you have any questions that we didn't get to today or you want to get in touch with us, we at the PBTF are here for you throughout the entirety of your journey. So you can give us a call or email us at the information on the screen. And just thank you so much. We hope you have a good rest of your day.